So I'm going to start today by asking a question. And that question is, what would a community do if it was given the opportunity to determine how to serve children, youth, and families on their own terms? It's a little bit past technology, but we start at the beginning. To me, the question is a lot like when we're working with a client and we ask, how can we meet them where they're at? And I know that you can go a lot of different ways with this question, and oftentimes probably simultaneously. So before I get started and actually talk about what the solution is, I'm just going to provide a little bit of background on Washington State and why my organization, Partners for Our Children, is thinking about this particular issue. So in Washington State, there's roughly around 8,500 children in the child welfare system at any given time. At the same time, there's another 800 plus runaway and homeless youth as documented in our one-night counts in just the Seattle area alone. Now, what I think is particularly interesting about the intersection of these two numbers is I don't think going to come as a shock to anyone in this room, but in Washington State, 500 youth age out of our child welfare system every year to unknown circumstances. And so the interesting thing, though, is that it's not just the children in our state that actually span these two boundaries. In our state, we have a lot of service providers, private service providers, who are serving both communities at the same time. We also have another layer. We have a layer of private philanthropy that is interested in both these communities at the same time. So my question is, if we know that the children are the same and they're being served by the same systems, why is things so bifurcated? Is this the way that the community we want to serve our youth? I'm not sure. So what do we do about that? So what I would say is that I think that we have an opportunity to use technology to push past the arbitrary boundaries and silos that we've created to allow our communities, which includes service providers, public agencies, funders, researchers, and even clients, to create a solution that allows us to coordinate and work together the way that we would have had not all those rules and reporting requirements and different data systems been layered on one after another. So my organization took a look at what was happening in the community, what people were saying, and we took a look at what existing solutions might be out there in the community, and we felt like there wasn't anything that perfectly matched what we were trying to do on a lot of different dimensions. And so what we ended up doing is creating a solution that we're calling Oliver. It's essentially a solution that's designed to connect providers with high quality information. Online, web-based, secure, low cost, all of that stuff. And it's designed with a UI that we think that humans might actually want to use as opposed to just the folks that are relegated to do the data entry to bring in your funding. What we're doing with that is hopefully creating a system where all providers can come in and share the same network, share information within the bounds of confidentiality, and then serve clients the way that we want. So what do we think about this thing that makes it different? Well, the one thing that I'd say that we're doing that's a little bit different is that we're starting from the community first and then going out to organizations, because what we've seen is that a lot of solutions are thrown out there and they solve a problem for one organization or one part of the system, but they're not sort of deployed through a whole ecosystem. We're trying to support the frontline workers foremost because they're the people who are doing the jobs, and too often its solutions are deployed to support people who are collecting data. We're trying to support continuous quality improvement by giving the people who are doing the work information at the time when it's most important, which is when they're with clients. We're focused on interoperability and data sharing, of course, within the realms of what's allowable. Which means a data model, APIs, all that stuff. So where are we at right now? We have been developing for about 8 months. We have 7 providers already using it. We have 250 frontline employees who are actually involved in the system, and they're working with 370 cases. So we're moving very quick. We have a lot of great support. So where are we headed? It's hard to know how far we've gone, but when we've been out there in the community, we feel that we have picked up on an appetite that people have to try and serve clients in a different way than we're doing now, and it seems to be that a lot of states are moving in that direction. So again, what we're trying to do is try and create something that's truly client-centered, that moves us away from counting units to trying to count how many youth get to where they're supposed to be going. Thanks.